Talking about the phobic disorder syndrome. So, as the word indicates and as the terminology indicates, the person will give you a history of a persistent or an extreme kind of fear that he has developed towards a particular situation or towards a particular object, and as well as the person will suffer from a comorbidity. Now, the comorbidity can be of an organic type, it can be a condition, any other medical ailment that he's suffering from. Even people with the terminal ailments, for example, the patients with cancers or any terminal ailment can present with a particular kind of phobia. So these are the comorbidities that we can consider in these individuals, as well as the person can suffer from any individual comorbidity of a psychiatric origin. For example, depression or the bipolar affective disorders can be present along with these phobias. And even when we talk about these phobias, a person can suffer from multiple phobias at the same time. It can be a single individual phobia, as well as it can be the multiple phobias, the agoraphobias, coupled with the social phobias coupled with the specific phobias, for example, the phobias to the height or to the water or to some dental treatments or the any other medical treatments. All of these phobias we have to consider in that particular person. So these symptoms are again very important. The behavioral and cognitive symptoms are again very important. The agoraphobia somatic symptoms are again very important over here. And then we can have the social and the special phobias. The person will give you a history towards when he's experiencing fear towards that particular situation. Now, the symptoms are usually of the panic attack that we've already discussed in a separate lecture. That basically the anxiety attack that comprises of the raised heart rate. The blood pressure usually rises in these individuals. There is basically a situation of fight or flight. So this is the situation that usually arises in an adrenaline rush that we usually experience in the emergency states. So this is a kind of an anxiety attack that the person will usually give you a history of. The person will have those tremors and sweating. So all of these are the symptoms that we have to consider in a particular kind of panic attack, anxiety disorder, or even the phobias. So the presentation of somatic, behavioral, and cognitive features that usually consists of the somatic or the physical symptoms, including of the dry mouth, feeling of choking is usually present. That is due to the retrosternal constriction that usually occurs in these patients. Then the difficulty in breathing is again due to that retrosternal constriction. Chest pain or discomfort is experienced by these individuals. Then the patient will give you a history of palpitations, pounding heart or the accelerated heart rate. Nausea or abdominal distress is seen in these individuals due to these panic attacks. Then the person will also give you history of sweating and trembling, hot flushes and cold chills, numbness or tingling sensations, feeling dizzy, unsteady, and then the faintness or the episodes of unconsciousness are usually experienced by these individuals. Then the behavioral symptoms that usually exist in these individuals are escape from the feared situation and the avoidance of the feared situation. Cognitive symptoms, they usually vary from feeling that objects are unreal. This is known as derealization. And then the self is distant or not really here, which is known as depersonalization. Feeling of dying or fear of losing control. Going crazy or passing out basically means having those episodes of unconsciousness. So basically, we divide these symptomatology into three major groups. They are the behavioral group, and then we have the cognitive group, and then we have the somatic or the physical symptoms. These are the presentation that we usually see in these individuals with phobias. The cognitive symptoms are the experience of anxiety and the fear of losing control over oneself. Going crazy was one of the terms that we used previously. and then fainting or even dying. So the person will have that uninhibited fear that he's going to die very soon. Then depersonalization, in which the person's self is somewhere else and he basically experiences that depersonalization criteria. It should not be confused with psychosis. Although the symptoms are quite similar to that of the psychosis, but when you have that trigger or when you have that stimuli and you have identified it in your history taking that this was the stimuli that basically triggered the panic attack, and when the person will give you the history of the repeated panic attacks with that same stimuli, then you're going to basically diagnose it that it is a case of a particular phobia that we are dealing with. They experience derealization as well in these situations in which he basically cuts off with the reality. So that is known as the derealization. The person can have hallucinations, or he may have or may not have the delusional phenomena. Then the behavioral symptoms, they are seen, they exit feared situations, as well as there's a marked avoidance of that particular situation. Specific phobias of bridges, it takes convoluted route. So it's not a straight route, it's basically quite a twisting and turning route. Agoraphobias goes shopping in quiet times and the person becomes virtually housebound. So he's basically uncomfortable in those open spaces in which he cannot escape into a safe place quite quickly. So this is when he basically stops shopping for himself and the person virtually goes housebound if the severity of the symptoms is at the extreme level. Then the social phobias, the person avoids all contacts with the people and they're beyond the immediate social circle. Basically, the person gets paranoid and his idea of the people is that the people are scrutinizing him all the time. So sometimes he'll give you a history that he doesn't like publicly speaking, or he doesn't like publicly eating. So these are few of the symptoms or few of the histories that you'll usually go through working as a psychiatrist and dealing with phobic syndromes or phobic symptoms. Now, the anticipatory anxiety, something bad is going to happen, I'm going to die. These are the usual thoughts that the person will go through due to these anticipatory anxiety. Then the person will have emotional distress due to those behavioral kind of group of the symptoms that the person is going to have. The person may have a phobia towards the bridges. Crossing the bridges, he'll have that phobia due to obviously that anticipatory kind of anxiety that he's going to develop, that I'm going to die due to an accident that is going to happen. So he's going to avoid each and every situation in which he can be dealt with in an accident. For example, crossing bridges is one of the very common phobias that people usually have. Then phobic avoidance is usually seen. The person will be socially housebound. He will not have that social interrelationships that a usual or that a normal person have. Talking with people, making friends, it's going to be difficult for that particular person. Then agoraphobia, somatic symptoms, they are usually seen in these individuals. They are rare on its own. They're associated with panic disorders, and they're due to the repeated unpredictable panic attacks as well. The fear effects should be focused on anxiety, and the comorbid depression is quite at a higher rate in these individuals. So the depression sometimes coexists with these phobic conditions. The fear or avoidance of crowds or publicly making an appearance is seen in these individuals as well. Now, the fear of being the focus of attention, socially getting embarrassed, the specific forms of special social scrutiny. Everybody's looking at me and they're scrutinizing me. So these pessimistic thoughts are going to be seen in these individuals. The symptoms are blushing or shaking, getting the tremors or the fear of vomiting urgency, fear of micturition or defecation. So these are the social phobic symptoms that a person can have or can develop. The comorbidity with the other psychiatric diagnosis is again very important in these cases. The degree of phobia depends upon about these specific situations. Exaggerated fear and anxiety is seen in these individuals, severity of distress and avoidance to avoid that particular situation that triggered that panic attack. It can be the dental treatments or any other medical treatments as well. Comorbidity with the other anxiety disorders is seen in these individuals, and it is quite less common with depression or with substance abuse. So basically, in this section, we dealt with the normal signs and symptoms that the person will show if he's suffering from particular kinds of phobias. So that is the end of this section. Thank you for watching sqadia.com.